Hi everybody, Dr. Sana Khan here with OKC Fertility, and today I am just going to talk a teeny bit about when to see a fertility doctor, what's going to happen when you see a fertility doctor, and then I'm going to do just a teeny little bit about trying at home on your own. So first off, when to see a fertility doctor, kind of the textbook answer is if you are under 35 and you have been trying to get pregnant for about a year with regular unprotected intercourse, it might be time to talk to somebody. If you are over 35, we actually usually say coming in a little bit sooner, around that 6-month mark, might be better just because it's a little bit harder to get pregnant as we get older, and I'll talk about that and the mechanics of that in another video. So those are kind of the times of when we usually recommend somebody come in. But the truth is that if you are worried, if you've ever had any GYN issues that make you wonder, it's never a bad idea to come in. We're never going to say, no, you have to go wait. We want you to come in. We want you to feel comfortable. We want you to have an idea. And so, if you are 32, but you've been trying for 9 months and you're not really sure and you're tired and you want to come in and ask some questions, it's always a great time. The doors are always open. What is going to happen when you come in to see a fertility specialist? So the basics of our evaluation is usually some blood work. A really important part of that blood work is what's called ovarian reserve. So we're trying to get this indirect idea of how many eggs you have in your ovaries, how you're going to respond to any kind of fertility treatment. We do that usually with some blood tests like an anti-Mullerian hormone, follicle stimulating hormone, and then also an ultrasound to kind of get an idea about how many follicles we actually can see at particular points in your cycle. And like I said, it just gives us this idea about how you might respond to any fertility therapy. Those are really important markers, but age is really important, and then also reproductive history. So we kind of put all that together and talk about, how we think you're going to do. Another really big part of the assessment is usually going to be some way of looking inside the uterus and checking the fallopian tubes, whether that is an HSG, hysterosalpingogram, which is done with radiopaque dye and ultrasound, or whether it is an SIS or a sonohysterogram, which is done with water and ultrasound. Usually your doctor is going to recommend one of those ways to kind of assess those two things. Check to see if the tubes are open or if we're concerned about the tubes at all, and then to make sure there's nothing coming into the uterine cavity that we think may affect your ability to get pregnant or to stay pregnant. We usually also recommend a semen analysis for the male partner if that is a part of the issue, just to make sure everything is okay on that end. Now, a lot of fertility doctors do this differently. Some fertility doctors kind of like to do some other testing, like making sure you're up to date on immunizations, wellness testing, making sure your other endocrine parameters are within the normal limits. It really just depends on your doctor and then your specific history. But most fertility doctors, they kind of want to hear what you have to say. And so if you're concerned about something, it's always something that we can look into. And so the assessment can be like really individualized from that standpoint. So that's kind of when to see a fertility doctor, what we're kind of going to do and talk about in those initial visits. And then the last thing I just want to touch on is kind of trying at home. A lot of people, I feel like this is one of the biggest questions I get as a fertility doctor is what's the best way to try at home? And really, whether you want to include an ovulation medication like Femara or Clomid is completely up to you and your doctor. But what I like to tell people to start out with is, if you're ovulating regularly, and the best, easiest way to kind of tell that is, do you have regular periods? Do you have a period that comes at a predictable time? Do you have kind of symptoms of bloating or moodiness or breast tenderness, kind of just these indications that your period is starting? Then you're probably ovulating. Sometimes the ovulation predictor kits or basal body testing, some of those other things can help narrow that down a little bit. But if you have regular periods, then you're probably ovulating. And then either you can really try to figure out exactly when you're ovulating by doing things like ovulation predictor kits, basal body testing, or one way that I recommend sometimes to get around all that is actually just, if possible, to try to have intercourse every other day for a week around your ovulation time. So let me just give you an example of that really quick. So if you have a 28-day cycle, then you're probably ovulating around day 14. And so if you start having intercourse on cycle day 10 and you have intercourse every other day until cycle day 18, then you're covered. Obviously, that logistically is really difficult sometimes if you have people traveling or hectic schedules. We've all been there, but that is just one way where, you can take a little bit of the stress out of trying to figure out exactly when ovulation is going to occur and exactly when maybe the best time to try is. One thing that I've seen sometimes is people wait for that peak day on their OPK, and they may have missed the best time to have intercourse because they kept on waiting, and we don't really know exactly when in that whole time that hormone peaks, you actually ovulate. So just a little hack to try to make it a little bit simpler, but I will definitely go into this more in subsequent videos, so stay tuned. Thanks, guys.